So this third part of adrenal disease, in which we'll discuss about Addisson disease. So in Addisson disease, basically this is due to the primary adrenal insufficiency. So most of the time it is due to the autoimmune adrenalitis. So let's recap what's actually the aldosterone and also cortisol function in the body. So as we recap about the aldosterone, it's basically helps in the sodium potassium pump. So in the case of low BP, there will be reabsorptions of the sodium, so that together with the sodium, the water will comes into the blood vessels and increase the BP. And as an exchange for the sodium, the potassium needs to be excreted, so there will be a hypokalemia. So in Addisson disease, when there is insufficiency of the aldosterone and cortisol, there will be first hyponatremia. Just reverse to this mechanism. So we'll be reducing the sodium, reducing the water, and cause the hypertension, low BP, and at the same time increase of the potassium. Together with the potassium, the proton will be used, so there will be reduced in the proton, so causing the metabolic acidosis. And then due to the hypocortisolism, there will be a hypoglycemia, and hypercalcemia. Okay, so in usual conditions, the symptoms will be non-specific, but the blood investigations will be obvious with the hyponatremia and hyperkalemia and hypotension. So the patients were complaining of myalgia, arthralgia, loss of weight, anxiety, and in Addisson crisis, which things that we want to avoid is coma, because Addisson usually in a chronic condition, but Addisson crisis, if it's acutely occur, so there will be low sodium and low BP. Patients will turn into comatose state. So how to investigate this condition? So the investigations is when we have the Synapton Test. So to recap again, this will be hypothalamus with the anterior pituitary. So we have the CRH that will be produced by the hypothalamus. So CRH will stimulate pituitary gland to produce ACTH, and ACTH will subsequently stimulate the cortisol in the adrenal gland. So in Addisson disease, in Synapton Test, Synapton basically is a synthetic ACTH. So how do we do the test? So in a normal condition, if we give a Synapton, there will be double up of the value of the cortisol. So let's say the Synapton will be given IM or IV, and the level was taken prior the medications, which is at the baseline. So say it's about 350. So by 30 minutes, usually the level will become doubled up. So it's become somewhere 734, 750. And then at 60 minutes, there will be increment, but not as high as double. It's just, for example, 843 nanogram per deciliter, 60 minutes. So in a normal condition, there will be a doubling, but in case of the adrenal insufficiency, which is Addisson, there will be no stimulations on the cortisol level. So basically, it will remain the same. Or other than Synapton Test, we also can take the level of ACTH and cortisol. So in primary adrenal insufficiency or Addisson disease, the ACTH will be high because pituitary gland try to stimulate the cortisol, but due to the insufficiency, the cortisol will always be low. While in the secondary adrenal insufficiency, there will be this condition usually due to the pituitary, so there will be low in ACTH and causing low in the cortisol level. So basically, the question they usually ask is about the Synapton test. So the last part is about the Pheochromocytoma. Basically, Pheochromocytoma is a tumor of the medulla of the adrenal. So as we know, the adrenal medulla mainly composed of the chromaffin cells, which will produce the norepinephrine and epinephrine. This is important in the fight and flight mechanism, in which it will stimulate first the alpha receptor, which mainly will cause a will basically the main actions will be vasoconstrictor at the blood vessels. So vasoconstrictor increasing the BP, better perfusions to the vital organs in order to fight and flight. So the second is beta 1 adrenergic, which will stimulate the heart, so increase in the cardiac output, increase in the heart rate, and also the stroke volume, also causing increase of the BP, if you can remember these equations. And the third place is the beta 2, which is in order to fight and flight, we have to have a good oxygen. So there will be a bronchodilations. You can think of medications like salbutamol. So in case of pheochromocytoma, there will be a triad of symptoms that usually the patient presented with. So first of all, patients will complain of pounding headache due to the high BP, and then palpitations because increase of the heart rate, palpitation. And the third one, diaphoresis, excessive sweating. So this is the triad that Mrcog also love to ask. And how do we investigate this condition? So in this condition, we can take a level 24 hours level of metanephrine.